This short video is an educational video for patients to help them understand what their disorder is. And it is TMD, not TMJ. We're going to go over that. This video is produced by the Atlanta TMD Institute. We are dedicated to advancing knowledge in TMD. First is to, if you look at our missions, to educate dental and medical professionals in TMD, to develop knowledge of temporomandibular disorders, and to successfully treat patients suffering with TMD. We are a secondary treatment facility where very often we treat patients that have been referred to us by other practitioners who are having difficulty or simply just don't want to treat it. So the first thing is the T stands for temporal, and the word temporal comes from time. If you look it up, it's on the side of the head. So this is a side of the skull. Got it? So your temples are right behind and above your eyes. And if you look at the side of the skull, the purple area of the skull is your temporal bone. So I've got the temporal bone labeled. It's purple. You see it got a lot of different parts, and we're just concerned about where the lower jaw connects with the temporal bone. So I have circled the area of the temporal mandibular joint, TMJ, and I've got it labeled in black. And then right behind it is the ear. And I do this because they're so close in relationship. They're actually, and you think about it, the same structure, and you're like, well, Dr. P, you crazy? The ear does different things from the jaw. But the malleus and the incus, which are the two of the three bones inside the middle ear, actually evolved from reptilian jaw bones. That God is repurposing and changing the use of things as he evolves out the human body. And get this, the stapes, which is the deepest bone, so you got the malleus and the incus, and the stapes is actually a fish lower jaw bone, or fish chewing bone. So all of these bones come originally from chewing parts, from fish originally, stapes, and from reptiles, malleus and incus, and they are very related. So you so often see ear, nose, and throat problems with jaw joint problems or temporomandibular joint problems with TMD. So the next letter is M, and M stands for mandibular, and that's the lower jaw. If you think about it, Samson beat off the Philistines with the jawbone of an ass. In other words, this is a very strong bone, and the teeth sit inside the mandible, and there's lots of different parts to this mandible, and it's kind of complicated. And teeth are kind of exceptional. They're very hard tissues, and there's different types of bone inside the mandible. If you look at the picture of the skull, you'll see a purple area below the skull, and that is the mandible. And the mandible detaches from the skull. It is not part of the skull. So you've got the skull and the mandible together. So just to reiterate and go over again, M stands for mandibular. The name comes from the word mandible. And I've got the mandible labeled. You see mandible on there, and I'm pointing to the purple area of the mandible. So I have circled both the right and the left mandibular condyles. It's just a name for where the mandible fits into the skull, right? So the mandible fits into the skull at the temporal bone, and it fits at the end of the mandible in what's called the mandibular condyle. Got it? So J stands for joint, and most people know about the knee joint because that's where we have, it seems like that's where most people have problems. And so the joint is where two bones meet and they connect together to allow for movement. So a joint connects two bones and the bones move against each other at the joint. Here is the knee joint, which is the femur and the tibia primarily that are moving together. So here we see T stands for temporal, M stands for mandibular, J stands for joint. So the abbreviation, something they call abbreviations like this, acronyms, TMJ stands for a joint, right? Not the knee joint, but the jaw joint. So I circled the name temporal mandibular joint, and it has a whole bunch of parts. You don't need to know about that. But I put the X where the temporal mandibular joint exists, and it connects the mandibular condyle to the temporal bone. So I'm going to try to make this logical why the term TMJ is outright stupid. So let's just go over why it's stupid. So the temporal mandibular joint is the official name for the human jaw joint or other jaw joints and other animals. All human beings, ones that are healthy, have two temporal mandibular joints, a right temporal mandibular joint and a left temporal mandibular joint. So people that do not have TMD do have temporal mandibular joints. They couldn't talk to you if they didn't have one, right? They couldn't eat if they didn't have one. And they have two, right? You have two temporal mandibular joints. It's a name for a joint. So you would never go to a doctor and say, doctor, we have to take care of this. I've got knee. I have knee. And doctor's going to say, yeah, you got knee. You got two knees, yes, and everybody got two knees. What's the problem? So it is a bad term because most human beings have normal temporal mandibular joints. So the use of the term TMJ is really not logical. It's not a good name, and it's so interesting. It's a little bit of a criticism of dentists that they let this go because they're not physicians. Physicians like names. Every little disorder and every little thing is a specific anatomical name. They like it. Dentists are a little more laid back, and so they've allowed this term TMJ to be used a great deal, even with professionals, and it is not correct. So it's really important to understand it's not just the temporal mandibular joint that's disturbed in TMD patients. Most TMD patients have a whole bunch of stuff like eye problems, ear problems, neck problems, all kind of stuff. They have thyroid disease. There's just so many things that they have, and it's all clustered together and stuck together. It's not just a joint. Got it? A lot of other things go wrong with TMJ or TMD, and I slipped, right? I'm brainwashed a little bit. A lot of other things go wrong, so it's called a disorder, not a jaw joint problem. The name temporal mandibular disorder takes the name of the joint, temporal mandibular joint, TMJ, out, O-U-T, of the name, so that the name TMD better describes the problems seen in TMD patients. And let me tell you, problems with with TMD will work them way all the way down to the tippy toes. This is true. Almost always. We see knee problems from locking, hip problems, all kind of stuff, and there's reasons for it. And there are. And these other problems should also be addressed through a multidisciplinary approach. You can't just make an appliance and say, oh, you're all right now, get out of my office. It's kind of like the guy that gives you a pill. Here, I know you have high cholesterol, here's a pill. Well, wait a minute, maybe it's coming from metabolic syndrome, prediabetes, Shouldn't you treat the prediabetes so that the cholesterol goes down and away? So I'm going to attempt to give you a deeper understanding of the name TMD so that you'll be really, really knowledgeable. And TMD is not a syndrome. So let's go over the definition of a syndrome. A syndrome is defined as a group of symptoms which consistently occur together or a condition characterized by a set of associated symptoms. This is very important. They come always together. So, probably the most common syndrome that people recognize is Down's syndrome. And almost anybody can diagnose the Down syndrome child or a person, you go in the mall, you say that's a Down's patient, right? Because every single Down's child has the same set of signs and symptoms. They have the flattened face, short neck, protruding tongue. They've got all the same things. So a syndrome, all people with a syndrome have the same sets of signs and symptoms. You've got this same. And it makes it easy to diagnose and recognize. You, even if you don't have a medical degree, could say that is a Down's child because all the signs and symptoms are together. So let's go over quickly the definition of a disorder. A disorder is not a syndrome. I want you to say, okay, this is a disorder, that's a syndrome. You should know the difference. It's extremely important because if you don't, it's going to confuse you and you're going to worry why Mrs. Jones has different signs and symptoms than you. And, gee, I don't understand this. I don't have that. So what is a disorder? What's the definition of a disorder? A disorder alternatively presents with varied signs and symptoms. So one patient A can come in with 7 signs and symptoms. One patient B can have 25. One patient, F can have only 2. And that makes it really confusing because each patient coming in, it's not like a Downs kid. Each patient coming in has different amounts and types of problems, right? And that makes it really, really difficult for healthcare professionals, especially ENTs, to identify a TMD as an entity, right? As something that exists, and they don't know it because it's so different in different patients. So I like to think of a disorder like a teenager's bedroom. You open the door and it's like crazy things all over the place, right? But when you open the door again 2 weeks later, it's crazy things all over the place, but it's different, isn't it? Things are moving around differently. And then a month later, differently, right? It changes. The disorder changes. And a dis means bad, order means bad order. The things are all out of place. And you get uncomfortable when you look into this room. But then 2 weeks later, you'll also be uncomfortable, but it'll be a different arrangement, a different disorder, right? And so I'm trying to say, depending on when you open the door, there's going to be a different disorder, a arrangement of signs and symptoms that people are experiencing. Very important. So what I like to say, or you have to understand is, in a disorder, the patient's body, could be your body, picks and chooses its own personal combination of signs and symptoms, right? Your body picks a little bit of this and a little bit of that, and I like to think it's like a Piccadilly cafeteria where you can go and pick out a little bit of this and a little bit of that. So everybody at Piccadilly cafeteria has picked different things. And you go, but they're all TMD patients. They're all Piccadilly clients who are eating in Piccadilly. So they have a little of this and a little of that, and you choose differently. But you know that each one of those foods is the combinations. You know the certain foods. So Basically, the foods are signs and symptoms. Each one, you can pick a little of this ear pain, you can pick a little of this eye pain, you can pick a little of this neck pain, you can, like, whatever, and I only want half neck pain. Like, give me half of neck pain. I want a whole bunch of joint pain, right? I'll take, or swallow problems. That I'll take maybe 10%. Give me a little bit of swallow problems. So there's just lots and lots of confusing things, but it is a disorder because it's not the same in every patient. It's a disorder because patients present with different levels of pain and problems and different types, but they all follow within the group of signs and symptoms that are associated with TMD. So I just want to quickly, differentiate or make very clear the difference between a syndrome and a disorder. Got it? A disorder varies, right? It can vary from patient to patient, and get this, it can vary in the same patient. So depending on what's going on at any given time, it could be that the jaw pain's terrible, but there's no headache. Or it could be that there's the same patient, then 6 months later, bad headache with no jaw problems, no clicking, popping, pain. So that's different, right? A disorder varies in its presentation so that different variations of signs and symptoms all can constitute a disorder, whereas the signs and symptoms of a syndrome are consistently the same. So it's easy to diagnose a syndrome, harder to diagnose a disorder. So I'm going to summarize this thing. The understanding of TMD as a disorder allows the patient and the practitioner, it could be the dentist, the ENT, the chiropractor, it could be the physical therapist, it could be the eye doctor, right? These people all need to understand it's a disorder. So the understanding of TMD as a disorder allows the patient, you, to understand that not every patient has all of the numerous specific TMD signs and symptoms. So you get confused and you say, well, Mr. Jones has TMD. I don't have the same signs and symptoms, so I must not have it. No, you are very unique. God made you very unique. And the way you digest your food, the way that you sleep, the way that you approach stress, everybody's different. And so they present with different signs and symptoms in a disorder. So in quick summary, please call it TMD because that's what it really is. Got it? And again, I'm reiterating the TMD Institute is in Atlanta, Georgia. We see patients who have been failed at other practitioners' offices or referred by specialists or referred by some dentists that just don't wish to treat TMD patients. But we have 3 thrusts to educate dental medical professionals in TMD, to develop knowledge of temporal mandibular disorders, and to successfully treat patients suffering with TMD. Thank you so much for looking at this. I hope that it's giving you a little bit better understanding of TMD so that you can, cope with it better and understand what's going on, right? Much thanks.